talk about bone on bone. It's a common phrase that gets thrown around to strike fear, to fragilize you, and it's just not accurate. But we could say that about any label. It doesn't make any sense as far as your next step. So let's talk about bone on bone with this real life scenario I actually just had. Gentleman convinced that he wants to do hip replacement, and that's fine. He's choosing that. My goal as a practitioner and working with him is not to talk him out of surgery. It's to let him know what's necessary and what is going to be required by his body, the cost of the truth behind when you get surgery, or the truth behind what's going to happen if you want to choose to not have it. Because both are going to come from the same place, but you have to be fully accountable and responsible. And surgeons don't have this conversation. Doctors don't have this conversation. Coaches don't have this conversation. So they first had to show an image. So they had to take an x-ray and show him that this is why you feel how you do. Because that's the only diagnostic criteria, is you don't feel good, or you can't do the things that you want to do. Done. That's it. That's where we stop, as far as where I stop. But modern medicine, natural medicine, holistic medicine, integrative medicine, worst of all, have to go in and prove to you their next move, their next step. So they're going to show you an image, a picture of a part of your body called the skeleton, right? If it's an x-ray. And so they're going to show you a skeleton, your skeleton. They're going to show you your ball and socket. Oh my God, look at that. And it's bone on bone, and look at all this lipping and spurring and calcification and sclerotic activity, and oh my God, oh my God, that's why you're in pain. And because of it's called A to P, anterior to posterior, a front view of your pelvis, because it gets a little bit of your spine in there, they toss in some spine comments as well. And look at this, look at your SI joint and your spine, your 4, 5, and yeah, look at that. Those are, we'll keep an eye on those. I mean, it's just like, if it's on the x-ray, they have to talk about it. By law, that's what they're obligated to do. If you take an x-ray, you are accountable to every fucking thing on that x-ray. That's why they have to talk about that. That's why the model is so stupid. So now, they've convinced him, and I'm sitting here listening to this, that this bone on bone is why he feels what he feels. And they're going to cut out this, do this new technique, and they're going to cement it differently, and it's going to grow in, and he's going to be okay. Great. So then I just had to step in, because the truth behind bone on bone, and he proved it, because this was the initial intake. It was months ago. Then we start to break this all down, and we start to make changes, and he starts to take conscious effort, and he's putting forth even just getting stronger, just basics, right? Because that's where we would start every case, no matter whether you're hospice, cancer, autoimmune, neurodegenerative. You have to start at the muscle level, because that's going to build up your capacity to make changes. Symptoms cost energy. Where's that energy coming from? That tissue alone, plus just your ability, capacity, resiliency to be able to just make decisions and sit in the face of everything you're going to face, which is you with you. So after months of really just kind of training is really what it was. Him doing it on his own with the occasional me coming in and revamping things and checking things. He got to a point to where he was 0 or 1 out of 100 pain. Shit. Okay. Not enough to convince him that he doesn't need surgery, that he doesn't want to choose surgery. That's fine. But then they had to do another follow-up. And they had to do another x-ray. All right. And this is months later. So, of course, the x-ray is unchanged because imaging just is unchanged. Nothing underneath that they're going to show is anything you want to get rid of, or and I'll get into that. But it doesn't matter whether it's MRI or whatever it's going to be. So, and so my client tells the surgeon, you know, there are times, because the surgeon's like, how you doing? He's like, well, I've been making some changes and doing some things differently, and I'm at a 0 or 1 out of 100 some days. And the surgeon's like, oh, really? Tell me what you're doing. And so he kind of broke down simply, but it's so simple what we end up doing and breaking down, not even training, just anything, that it blows their minds. They're so up their ass with terminology and education and licensure that they just can't comprehend simple. It literally simple goes over their head. So he's sitting there and he's listening. He's like, oh yeah, you want to know what's going on? Is now you're creating more pressure down onto those bones, and those bones are fixating on themselves, and there's more stability with the bone on the bone, and so it's creating more stability, and that's why you don't have pain. I'm like, wait a second, I have to intervene here. Wait. And this is what professionals end up doing. They talk themselves into a circle. You just said the cause of all his stuff is because of this bone on bone. Now you're saying the cause of his no symptom and increased ability is more bone on bone, like more bones touching bones. I was like, wait, do you now see that this doesn't make sense? Client's like, yes, I do. I understand. Just so you're clear, this is who's cutting on you, and this is the approach they're taking. You just need to own this. But do you see how this medicine just doesn't understand? They just circle talk, expecting you to be a total fucking moron. And this is allopathic surgical orthopedic. Like, let's not even get into hormone specialists, oncologists, autoimmune specialists, registered dietitian. I mean, you fucking name it. The more natural, the more moronic. They literally will just circular talk themselves off of the initial test, because they have to have a test. Nobody can guide you without touching you, selling you a product, a bottle, or showing you some lab value or marker that's the cause and that's what we're going to fix. And now we're coming back to where genes caused this. As if epigenetics didn't screw everybody up enough, now we're coming back to, oh no, it's not above genes. It's not that you can control whether genes turn on or turn off, but they're still in and you're still scared of your body. But now it's genes are causing this, and the other, and you need to get genetic methylation tests, and you need to see this stuff ahead of time and throw a bunch of supplements. And then if you have continued symptoms afterwards, you're one of the 4%, because this genetic test is only 96% accurate for this. I mean, it's literally just this ongoing, doesn't make sense. So bone on bone, you could have for the rest of your remaining years, and you wouldn't know, or your body would give you symptoms to understand that you need to make some changes. But it's not bone on bone that's doing it. And here's what's crazy about imaging, medical imaging. Everything that is essential to this person's next move is everything the image doesn't show. You can't control your bones. You can't control your bones without going through what's not even on the image. You can't grow bone. Your body does. You can't lose bone. Your body chooses to lose it as a perfect response, just like growth. So everything they're showing you, you don't fucking do anything anyway. And you could do PET scans, DEXA scans, it doesn't fucking matter. Everything that's not pictured is what matters most. What? The animated tissue, the feelings, the thoughts, the beliefs, the stories. What's coursing through their blood? What's coursing through the trust they have with themselves? Are they lying? Are they not? Are they on medication? Are they on herbs? Are they under a practitioner's care? What's the story they have around their body? Everything not in that picture is everything that you're going to have to calibrate in and understand to take your next step. The picture determines nothing about your next step. That'd be like judging somebody's value based on their shadow on a fucking wall. That based on the shadow, I'm going to deduce, oh, this person is obese and unsuccessful and moronic, and they aren't going to have good test scores, and they're alcoholic, and they're susceptible to addiction, and it's a fucking shadow on a wall. That's all imaging is. It's just light casting on a shadow, producing whatever they want to show it. It is so nonsense. So again, I know I'm getting all worked up, but bone on bone, they convinced you now because they can show you, Jesus, that's my hip. That's been your hip for 30 years. You didn't know it.
but you have your body telling you that there's a feeling, there's a sensation. It's not that. That's part of all this. And you're not going to do anything in consideration of that. Because the goal isn't to reduce that or fix that. Because you can be 0 out of 100 with full ability, full strength, full effort, play pro sports, play pickleball, play fucking whatever you want, and be bone on bone for the rest of your life, and you wouldn't have any idea. You could have torn ligaments, torn labrums for the rest of your life. You got tumors all over you. Have no idea. They do not determine your next move. Anything in a medical image does not determine your understanding of your own body, nor your next move. Say it fucking again. Nothing in a medical image gets you to understand your body and determine your next step. Bone on bone is just part of it. A gateway drug into the labels. Because here's the scary part. Get rid of the labels. Get rid of the imaging. Get rid of all the stuff. Who's left standing? You are, the individual. And that is scary, but that is your greatest power. That is what nobody wants you to understand. That you with you lack nothing. Everything going on in and under your skin and on top and around you is all for you. You cannot have that story be owned. That is not controllable. That is, it's a power that would lead to people not being able to be manipulated and influenced and coerced. And that's the name of the game. Quadrillions of dollars are at stake. So, bone on bone doesn't mean you're fragile, doesn't mean has nothing to do with it. Medical imaging, judging a person's value by a shadow on the wall. Think about that.